I'm Dr. Langley. I'm a family medicine doctor in Colorado Springs, Colorado, here in wonderful Pine Ridge Family uh, Pine Ridge Family Medicine. It is a direct primary care practice, and I'm also a lactation consultant. And so breasts are something I deal with on a regular basis. I help for parents to achieve their breastfeeding goals, but then especially after a few years of being away from that time period, I talk with a lot of women about their breast and breast cancer because stupid statement of the day, breast cancer is really scary. And a lot of these women have breast cancer in their families, which makes them extra nervous, or they have friends that are getting diagnosed. But one of the scariest things that I've ever read is that most women being diagnosed with breast cancer don't have any breast cancer in their family. So there's sometimes not a warning like that, something that's triggering them to be extra watchful, doing their breast self exams, things like that. So I like to talk about breast cancer screening a lot with my patients. For sure, whenever I do a pap smear, we have that conversation because that's when a lot of them are expecting to have breast exams. But here's something that not always isn't always mentioned, that a lot of organizations and like medical organizations giving reasonable recommendations about breast cancer screening recommend against doing clinical exams of breasts, meaning a doctor, a provider doing a breast exam, and also recommend against doing self exams. Huh. That those kinds of exams tend to lead women to worry about things that aren't really there and end up getting more testing than they need to, causing more stress than they need, more anxiety about having this lump, having unnecessary biopsies, things like that. Hmm, something new for you today, I hope. But I still end up talking with women who want to do breast exams about what they're feeling. I mean, that's entirely up to them. Just because it's not recommended doesn't mean I'm going to yell at my patients for doing breast self exams. But as long as they're going to do them, let's talk about them and teach you what you're looking for, what's normal, what's not normal. And I'll often do breast exams with them to kind of talk them through it. So, what is being recommended by these organizations? Well, let me tell you, mammograms are a really good way to look for early breast cancer and to detect it early and to be able to avoid dying of breast cancer and finding it early and having it treated sooner rather than later. But the age that you should start getting mammograms, man, there's so many organizations out there that have different opinions on that. So the U.S. Preventative Services Task Force, which is one of my favorite organizations, recommends having mammograms every 2 years and definitely starting by age 50. Whether you start earlier in your 40s is an individual concern. Kind of depends on how much you want to risk having a mammogram that comes back as potentially cancerous, but then finding out, nope, it's not after all, and you went through all that stress and maybe a biopsy for nothing. How worried are you about cancer versus that biopsy coming back normal and going through all this for nothing, all that expense, all that stress for nothing? Which, how does that weigh in your personal life? How much do you personally worry about having cancer? How much are you going to pursue every little possible positive result? It's a very personal question, and it's something I try to spend a good amount of time with my patients on. So everyone pretty much agrees across the board. At age 50, you should start having mammograms every year, maybe every other year. And then after age 70, it could go either way. If you're already in poor health because of other things, let's just not mess with these mammograms. If you're in great health and it looks like you're going to live till you're 100, maybe consider continuing to have those mammograms until around age 75 is where everyone agrees, hey, your risks of dying of other things versus dying of breast cancer has changed, so it's not so worth pursuing those mammograms anymore. Everyone has to die of something someday, so at which point do you stop doing those uncomfortable and possibly very worrisome testing? So between 50 and 70 for sure, everyone agrees, but in your 40s is really the question. No one thinks that you should start having mammograms earlier than 40 from what I could find. So that's including the Canadian Task Force on Preventative Health Care, and the Canadian Task Force actually recommends specifically against having mammograms in your 40s. because there's so much of a risk of having an abnormal result that ends up being nothing. Because the secret is that younger breasts are harder to see through. They're denser. They're more difficult to appreciate the normal versus the abnormal. The older you get, the tissue in your breasts change so that they're easier to see on mammogram, which definitely happens in your 50s. But in your 40s, your breasts are still young enough that that's a really difficult thing to see through sometimes. So that's why there is that possibility, even more when you're young than when you're older, of having an abnormality that ends up being absolutely nothing. In the United Kingdom, they actually specifically say start at age 47 for your mammograms. In Australia, they recommend absolutely starting at age 50. Don't bother with the 40s. So all these different opinions. Within the U.S. specifically, there's the American Cancer Society that recommends starting at age 45 for sure. The ACOG, College of Obstetricians and Gynecologists, recommend starting at age 50 for sure, and in your 40s, it kind of depends on the person. American College of Radiology, since the radiologists are the ones actually looking at these mammograms, recommend starting at age 40 and going every single year all the way up through age 70, and even past age 70, depending on the individual and what else is going on with their health. And you've got to think about what these organizations are. Do they have financial incentives? So for the radiologists, they're getting paid for every one of those mammograms. So it kind of makes sense that they encourage you to have more mammograms. That's why I really like the U.S. Preventative Services Task Force, because they specifically try to not have those opinions that they can kind of step outside of the opinions that other folks might have financial reasons to want to recommend one way or another. Okay, so you've decided that you want to at least be aware of what's going on with your breast, to do regular breast exams. You know that you'll take your findings with a grain of salt, that you'll talk with your provider, consider getting an ultrasound or mammogram before you really start worrying about cancer as much as possible. That's cool. So if that's what you've decided to do, let's talk about what I would tell my patients about how to do their own breast self-exams. I recommend doing exams sometimes in the shower, because your hands can kind of slip over your skin a little more easily. Maybe put some soap to help them slide so that you can feel every little inch of your breasts. And sometimes do them out of the shower in front of the mirror, because sometimes cancer will pull on one side of the breast in a funny way, so that if you press here, it'll press and make a little dimple on the other side of the breast. So that's something that you can look for in a mirror, which you can't necessarily tell otherwise. Make sure that when you're feeling your breasts, that you start way up in your armpit, because there's actually breast tissue all the way up there. And then I recommend making little spirals of pressing here all the way in a spiral around your breast, and following the same pattern from month to month, so that you are feeling the same things. You get to know which lumpiness is always there. Everyone has a nipple complex behind the areola, kind of a cylindrical, almost like a disc is what it feels like, and that's a normal thing to feel behind the areola, behind the nipple. Also, you're looking for rashes on your skin, because that can be the way some cancers present. You're also pressing on the nipple to check for any nipple discharge. If you're not lactating and that's a new discharge, that would be something to talk about with your provider. There's lots of non-cancer things that might cause that, and there's some cancer things that might cause that. So something to just talk about. It's a worrisome thing to have any signs that you might have cancer, absolutely. So it's that balance of wanting to find the cancer early, but also not be worrying for no reason over things that aren't really there. So there's a little bit of a background of why your provider might not recommend doing a breast self-exam or doing a breast exam even in clinic with your provider, and might instead recommend a mammogram and not start nearly as early as you were expecting to. So maybe not even in your 40s, maybe even waiting till your 50s to start getting regular mammograms. But I do recommend after you hit your 50s for sure, please get those mammograms at least every other year, maybe every year. Often in October and May, different radiology associations will recommend a discounted price because of Breast Cancer Awareness Month. So keep an eye out for those to try to make it more affordable. I would love to eliminate breast cancer because it's a terrible disease, but it's a careful balance of not destroying your life and being really stressed out about it all the time and finding it early. Hopefully this was helpful. I think that this video would also be of interest to you, and be sure to subscribe to our channel here so you can find out when we release new content. Thanks for watching.